Peace, man. Oh boy. Yo, I gotta put on my doctor's hat today. So, Aboriginal Medical Association, we official today. Now, I talk about a lot of stuff, so I'm just trying to deal with this because this come to my attention. I just want to drop it right hot because I know might be a lot of people that need help with this, and you might know people that need help with this. And I'm just here to let you know there is help that you can do. There's things you can do right now, right here, non-invasive, to help clear up this situation here. All right. So today we're dealing with a little microbiology. I say microbiology. All right. So what we have here, right here, this thing is a bacteria. It's cylindrical, so it's called a bacilli. All right. So cylindrical is purple. It's gram positive. All right. So we have a bacteria, cylindrical, gram positive. What's that mean? That means this one, Clostridium difficile, actually produces a spore. And if you go back to my mushroom piece I did the other day, I showed you how spores proliferate in the body. All right. So amongst a lot of patients right now, they are having this it's called C. diff, Clostridium difficile. All right. They call it C. diff in the hospital. So they're really talking about this bacteria. What it's doing is causing colitis, basically. Colitis is an old term for any bowel issues. So people were drinking poison water and spoiled food, and they were getting diarrhea, bloody stools, dehydration, all type of stuff. So that was called colitis. And you'd be surprised how many people, especially in Europe, died of colitis. Look it up. They shit themselves to death, like on the reels. Right? Think about that. That's serious. This is a real problem, especially in Europe, especially because they had a lot of additives in their food. They would sell you bread and they would add sawdust so they can make more money. Oh, just like they do right now. Look at the ingredients on your foods you buy. Ain't nothing most. I can tell you right now, 85% of that shit on that ingredients list is additives and preservatives, toxins. All right? I can guarantee you that. All right, so they're doing the same thing right now. That's why you're suffering for so many bowel issues. Runny bowels, clogged up bowels, no bowels because they're cutting them out. All right? That's what you're dealing with out here. All right? And this little thing, C. diff, they're blaming it on what? On unclean, unsanitary practices in hospitals, basically. So this is what they call this a nosocomial infection. Nosocomial means hospital-acquired disease. Nosocomial, hospital-acquired. So you have a hospital-acquired infection, they call you. But the problem is everybody got C. diff in their bodies already. All right, so what the hell are they talking about? Let's check this. Let's go to the definition, my fam. Let's look at this definition of Clostridium. Oh, Jesus Christ. Even I have difficulty saying it sometimes. Okay. It's called Clostridioides difficile infection. All right. Known as C. diff. All right. A symptomatic infection due to the spore-forming bacterium C. diff. Symptoms include watery diarrhea, fever, nausea, abdominal pain. Can lead to cancer. They say if not handled properly, it's just possible. Antibiotics can contribute to detrimental changes in gut microbiota. Specifically, they decrease short-chain fatty acid absorption, which results in osmotic and watery diarrhea. So you got malabsorption. Why? Because somebody else is absorbing that nutrients. If you look down at this little picture here, down there, see that little yellow spots? That's your C. diff. That's an infection. It's yellow. You see it's yellow? The pink behind it is the skin of the gut, or the intestinal, the the guts of the intestine. That's the skin. It's just skin. All right. And the yellow parts are the infection. The C. diff is spores have grown and multiplied and cause an infection. Like I said in my video previously a few days ago about that yellow and green, that means infection. When that yellow stuff come out your nose, and green, and corny, you're infected. That means you have an older abundance of bacteria or some type of infective substance or some other pathogen in the body. All right. So, spread by bacterial spores found within feces. That's kind of tricky. See, yes, the spores are spreading in the feces. The C. diff spreads itself in the feces with spores. All right. They're trying to say that you go to the hospital and you get some feces on you and you got the C. diff. No, the C. diff been in you the whole time. You have millions of bacteria in your body, especially in your gut at any given time. There's a balance within the gut but microbiome that allows everything to be chill so you don't get infections like this. All right. But since you've introduced the antibiotics from the hospital, the doctors have caused the problem because they're trying to treat diseases which are caused by your poor diet with antibiotics. No. You have to change the diet. That's what needs to be done. And then you don't worry about this stuff no more. All right. So as you can see, this little bad boy is causing a whole lot of problems for people. And in the hospitals, they're acting like they don't know what to do with it or they don't know how to deal with it. All right. A lot of times you get this C. diff for a very simple reason. Antibiotics. Antibiotics destroy healthy gut bacteria. How you like that? They destroy the environment, the healthy gut bacteria that lives in. So now you got this overpopulation of these spores, these bacilli. All right. They produce spores just like a mushroom. See, everything is related here, but this is what's going on. Now you got a bigger problem. You got chronic diarrhea. Sometimes you got blood coming out of your stools. They don't know what to do with it. They have a few antibiotics they can use. They got long-term, short. But for the most part, people are getting it over and over and over again. Why? Because they don't teach you about your diet, fam. All right? And they don't tell you that the antibiotics are causing the goddamn problem. The antibiotics they're giving you are making the environment in your guts friendly to the overpopulation, overgrowth of this bacteria. That's all that's going on. So you're dealing with a bunch of people that act like they don't know what the hell is going on. And that's why you don't know what's going on. And you don't know how easy it is to deal with something like this. See, because they're telling you now. But see, guys, remember, they have turned this infection into an industry. They've turned this infection into an industry. All right? They've turned this. Do I have to say it? Can I say it again? They have turned this infection into an industry. So now they have antibiotics on top of your antibiotics. That's another load of antibiotics they sell you. All right? It's another procedure because now we see where the quote unquote fecal implants came in. So if you remember a few years ago, man, I must have seen like 10, 15 years ago, they started doing this thing called fecal implantation because so many people, white people, are suffering from colitis type symptoms that they said, let's do something. We'll do a transplant. We're going to transplant fecal matter from one person to another person to grow healthy gut bacteria. Really? Then does that make any goddamn sense to you? Does that make any goddamn sense to you? Huh? That's what they're gonna do? You're gonna reach your hand in the toilet, grab somebody else's crap, and stuff it in somebody else. Well, how do you determine who has healthy crap? Mr. Doctor, what do you guys? Is there a vetting phase? You have to test everybody's stool before you put it in somebody? Huh? It's stupid because that's not. It doesn't have to be done, but it's something they can monetize. They can't monetize you going to eat more pickles, fam. Right? They can't monetize you eating sauerkraut. They can't monetize that. All right? See? They can't monetize that. So they rather come up with a whole obtuse procedure of stuffing shit from one person's shit into another person's asshole or intestinal. So maybe a doctor. They're going to take the fecal matter from one subject and place the fecal matter into another subject patient who is ailing from serious C. diff side effects. No, that makes no sense. That makes no sense. And they have to put it in that language because if they told you exactly what they were doing wrong, like I just said, you would say, hell no, that's freaking stupid. See what I'm saying? They use the language to dress it up. When I'm telling you, all they doing is stuffing shit from one person to another person. That's what they're doing. And no, that's not the answer, nor is that necessary. All right? That's why we have 25,000yearcycle.org, fam. That's why I have the Real Detox Kit. Because that's going to have stuff in you to help you kill the C. diff. It's going to help you clean out the bacteria and the pathogens of your gut. Know what I'm saying? It's going to help create a healthy environment so those anaerobic bacilli like C. diff cannot proliferate in there. They're already there. But you don't want to feed them. What happened is this person had a diet that fed bad boy here. That's all. You had a diet that fed it. So it's just like when they put the mycelium on top of the grain. They found they had a whole bottle of grains. You call them wheat. You call them pancakes. You call them pasta. See? Shit is all gone. This shit is a circle. Alright? You call it cereal in the morning. You call it, what's they call it? Fruit Loops. Or you call it Wheaties. See what I'm saying? That's food for these things to get onto and reproduce themselves out of control. And in the process, change your gut biome, the balance of it, to anaerobic, which means low air, and turn it into a real proliferation problem. And you got these polyps, these infections all over your guts. All right? I'm here to tell you, you ain't got to go do all of that. I'm here to tell you that. And the motherfuckers, excuse my language, the people that are causing the problem are the ones you going to get the solution. They caused the problem and they're giving you a solution to something they did wrong, so they get to bill you twice. No, they're gonna bill you thrice, quadruple times, sextuplets, whatever times they're gonna bill you over and over again, because you keep going to them and you still don't know shit about health. Don't you get it? You keep going year after year, checkup after checkup, and you don't know, they ain't taught you a goddamn thing about health. And they're taking the money out your check every month, every pay period. All right? Regardless of whether you go or not. And they're charging you these crazy freaking co-payments just to walk in the office. So they're taking a percentage out every month of your money. Then they charging you $50, $75, $85 just to walk into to see a doctor. It's a scam. It's a scam-demic. It's a scam-demic. So, yo, I'm sorry, did I go off on a tangent? I may have gone off on a little tangent, but that shit was apropos, wasn't it? Wasn't it? It was right in his act, wasn't it? All right. So if you're having these issues, it's your diet. Change your diet, fam. Go to 25,000yearcycle.org. Go to the blog. Look up the what we should eat and what we shouldn't eat. It's right there on the page. It's free. Stick to the diet, and you won't have a lot of these problems. And if you do have problems, they'll be easy to adjust with supplementation or adding something or taking something away from the list, because the list is a general list. If we're in disease states, we have to tailor it to that disease state. But this is the food. This is the foundation of what we should be consuming. Understand? So, yo, you ain't got to suffer from these things anymore. Let's clean out our guts. Let's clean out our minds. Let's clean up the words that are coming out of our mouths. All right? Not that cussing is dirty. See, words are just used to express ideas, emotion, things like that. Profanity can be used to educate. You call it, what's so-called profanity can be used to educate. All right? To express, to make things harmful. You shouldn't be a stream of profanity one after your whole, out of 27 word diatribe, it can't be 20 words of profanity. That's like you're not trying to communicate at all. All right? But let's not be scared of words. Words are not the problem. Your actions are the problem. It's not the words you're using. It's the actions that you're taking. Change your actions, change reality. Your reality. Your gut health reality. All right? Your lung health reality. All right? Your muscle mass reality. You can change all of that. You know what I'm saying? I can't make you taller and shit. Like if you 5'5", I can't make you 5'8". That shit ain't gonna happen. Unless you 5'5" at 10, then I can guarantee you're gonna be about 5'8". You know what I'm saying? But if you grown up, I can't do that. We don't do that. Because that's just a natural limitation. That's your height. But your weight, you can change. All right? The morphology of your body, you can change. You can go from fat and pudgy to thinner or less body fat and more muscular. You can do that. But it takes will and it takes commitment, and you're going to have to stay on your diet and have some damn discipline. Weak people do not make changes. All right? Weak people are changed by the strong. All right? Change for the strong's benefit. You live in that society. You should be familiar with that situation. All right? But yeah, so ultimately I'm saying, yo, these are not problems. There's other things, these colitises and C. diff and Clostridium botulinum, food poisoning, and IBS. Bro, stop. These are not real problems. These are mouth, elbow, hand problems. You got the shit in your hand and you bend your elbow and you put it in your mouth. That's the problem. That's the big problem. So we got to change what goes in your hand. So when you bend that elbow to put it in your mouth, then, it's something better for you. They won't cause these problems. They won't take you out of balance. Help balance out your gut bacteria as opposed to make it swing one way or the other. Because both acid and alkaline can be a disease state. Alkalosis and acid. Alkalosis is as much a disease state as acidity is. All right? So we're looking for balance. So let's balance out our guts. All right, you can use the GI cleanse, or you can get the Real Detox Kit. The Real Detox Kit is better because it's got the blood formula and the liver formula, so that after you take care of the gut, you can move into the blood, to the liver, the gallbladder, the kidneys, the pancreas, and also your cardiovascular system. It's like 3 weeks, like 21 days, just to get you going. But you're gonna have to change your diet for sure. Else you're gonna be getting that GI cleanse every goddamn 3 months. Changes in your hands, fam. Let's make it happen. All right. This is Dr. She. Peace.